The consultation is probably the most important part of this whole process, because in the consultation we find out what is the problem and we develop a plan to achieve a good outcome.
It's very difficult for them to come in here because they're going to show something they don't really like. And, we just talk to them about other patients' experiences. We let them know that they can talk to other patients if that's what they'd like to do. And we just try to talk to them like we would want to be talked to, just face to face, and know the facts and make them feel as comfortable as possible.
They achieved that more than I could ever imagine. Abby was wonderful. I sat with her, and within 5 minutes, I was opening up to her.
Abby is the best. I love her. She is like having a girlfriend that you just come to the office and she makes you feel so good.
I try to look at every patient that comes in the office as a sister or a friend or a brother and try to make them as comfortable as possible, because once we make them comfortable, they're going to be able to let us know exactly what they need from us, and we're able to tell them exactly what we can give to them.
She asked me what my fears were, my concerns, what I expected, and I told her, and she told me her expectations too out of me.
It really helps to have Abby come in, and because she is a female, I felt it kind of loosened me up a little. I could ask her some questions, and then this is what they do for a living. They're comfortable answering any question that you have, no matter how bizarre I may think it is. And then when Dr. Banis comes in, you're like, oh, Abby already answered these, and so it's definitely more comfortable to ask him some of the personal questions too. Especially it is one-on-one too. That helps a lot.
We consider it our goal to, within 15 minutes between my staff, Abby, and myself, to have set these folks at ease. And she sort of warms them up and softens them up. And then if I can't have them relaxing within about 15 minutes, then I'm doing something wrong, or they're a very hard nut to crack.
He just came in and made me feel at ease, immediately, because he's just so nice, and he makes you feel like he has nowhere else to be but with you at that moment.
Well, he sat with me and, was asking me questions, which a lot of doctors don't have time to do. Asking me, what is it you want to accomplish? And it was flowing so easy that I just felt so comfortable to tell him about the reasons I was here with him.
You don't even feel intimidated by him. You know how you feel intimidated by some doctors because they're just like, they talk to you like over you sometimes, but not Dr. B. He's so nice and so warm and so genuine.
He comes with very, very high credentials, but when I came to meet with him, not only did I know that he was very well educated and had lots of experience behind him, he talked to me from the voice of experience. I could tell he was not textbook language about what he could do and what the pros and the cons were. He was talking from hands-on personal experience that he has had and has developed over these years. That gave me so much confidence and faith in him that he was going to be the best doctor that I could find.
The focus here is not me. It's that client, that patient that comes in asking for help. And if that's your baseline, then what they need is your time. They need your time to educate them. They need your time to listen to them, to find out what their actual objectives are, what their problems are. And in fact, they often really don't know until they start talking to you.
He respected me, he was empathetic, and treated me with dignity, and educated me about all of the pros, the cons, the options, and he was just wonderful. So I knew when I came to Dr. Banis and we sat down and talked about all of this, I knew he was the right surgeon for me.